Chapter 24, Therapeutic Agents for the Reproductive System. In the beginning of the chapter, we have select common drugs for conditions affecting the male and female reproductive system. It would be beneficial for you to go over the pronunciations of all of these for practice. So in men and women, reproductive functions divide between primary, secondary, and accessory organs. The primary reproductive organs are the gonads, the ovaries or testes, which produce the gametes, cells, namely the ova and sperm. The gonads also secrete hormones that provide male or female gender characteristics. The secondary reproductive organs include structures necessary for transport and sustenance of eggs and sperm, and the organs necessary for the growth of the developing fetus in the female. Accessory organs are ducts, glands, and external genitalia. Hormones largely control the reproductive system's functions. Estrogen and testosterone are present in both men and women, although their effects are somewhat different because of what different concentrations that are in each gender. So table 24.1 lists select hormones affecting the reproductive system and their functions. So it tells you the hormone, which gender, and then the functions. The two ovaries in women are responsible for the production, oogenesis, and secretion of one or, in rare cases, 2 eggs or more, ovulation each month. Located on either side of the uterus, the ovaries sit above the uterus attached to the fallopian tubes, which connect the ovary to the uterus. Although ovulation begins at puberty, it is not possible to become pregnant until the menstrual cycle begins. The ability to have children ends as the levels of the responsible hormones, like estrogen, decline until the ovarian cycle stops. The ovaries, which secrete the hormones estrogen and progesterone, are the primary source of estrogen in women. The function of estrogen is the development of breast and genitals and the regulation of the menstrual cycle, which prepares the female for pregnancy. The anterior pituitary gland releases follicle-stimulating hormone, which triggers estrogen levels to increase. This in turn causes the secretion of luteinizing hormone, another pituitary hormone. The combination of these two hormones trigger the cascade of events that causes ovulation. Figure 24.1 depicts the female pelvic organs. Figure 24.2 shows the normal menstrual cycle. After puberty, the female ovary matures 1 or more eggs each month. At birth, the female ovary contains all the eggs available for the woman's lifetime. So that's kind of interesting to think that when women are born, they already have all the eggs that they're going to ever have in their lifetime, even as a baby. Thus, women do not produce viable eggs throughout their lifetime. When an egg is mature, it is gathered by the ovarian fimbriae at the opening to the fallopian tubes. The fimbriae are in constant motion and sweep the egg into the fallopian tube. At ovulation, their activity increases and currents generated in the perineal fluid are created to propel the egg into the fallopian tube. During the next 7 days, the oocyte moves down the fallopian tube where it becomes fertilized by sperm. Because an ovum is viable only for 24 to 38 hours, fertilization usually occurs in the fallopian tube. The fallopian tube exits into the uterus, which either houses the fertilized ovum or sloughs the ovum, and endometrium during menses if fertilization has not occurred. This cycle begins at puberty and continues until menopause. Figure 24.3 depicts the female reproductive system. Gonadotropin releasing hormone secreted from the hypothalamus acts on the anterior pituitary gland to secrete follicle stimulating hormone and luteinizing hormone, the hormones necessary for ovulation. These hormones are controlled by negative feedback and are secreted in cycles. Unlike the continuous secretion of sex hormones in males, the levels of hormones peak when the woman is in her 20s and gradually decline through her lifetime. The mammary glands are accessory organs of the female reproductive system. Hormonal secretions regulate breast tissue. The principal medications that affect the female reproductive system are hormones. Some agents stimulate secretions, where others inhibit or counteract the actions of other hormones. Medication therapy for conditions of the reproductive tract can be complicated. Even male hormones are used to treat endometrial or breast cancer, endometriosis, and fibrocystic disease in women. Remember that the hypothalamus cannot distinguish between hormones naturally produced by the body and those administered as medications. Therefore, the body reacts to synthetic and naturally occurring hormones similarly. Table 24.2 lists select hormonal therapies for the conditions of certain female reproductive conditions. So for endometriosis, we have gonadotropin releasing hormone medications like Lupron or Zoladex, androgen, danazol. For infertility, we have menotropins, gonadotropin ovulation stimulators. Selective estrogen receptor modulators, an ovulation stimulator like Clomid and progesterone. Hormone replacement therapy. So for people that are currently have menopause, we have estrogen derivatives, estrogen and progestin combinations. Estrogens are one of the most common forms of medical therapy used for conditions of the female reproductive system. Specs 24.1 lists the different menstrual disorders. Estrogens are also available in several forms, such as implants, vaginal inserts, transdermal systems, oral medications, injectable preparations. The oil-based injectable estrogen medications called depot medications are prepared to prolong the medication's action. Male hormones can be used for treating certain female breast tumors that grow faster in the presence of estrogen. Androgens suppress the effects of estrogen, thus preventing rapid growth. For women with endometriosis, androgens can cause suppression of the endometrium and thus prevent the excessive uterine bleeding associated with the disease. Progesterone is naturally occurring as progestin, is the female hormone secreted from day 14 through day 28 of the menstrual cycle. This hormone has many functions, including changing the secretion of the cervix and reducing uterine contractility. Other actions include stimulating the development of ducts and glands of the breast in preparation for lactation. Progesterone Provera, Depo-Provera, Depo Sub-Q Provera 104. It's indicated for amenorrhea, contraceptive, and abnormal uterine bleeding, endometriosis, and endometrial cancer. Female hypogonadism is the lack of estrogen produced in the ovaries. In adult women, hypogonadism can cause infertility and early menopause. An infertility treatment evaluation typically begins after 1 year of regular unprotected and estrogens are also available in several forms, such as implants, vaginal inserts, transdermal systems, oral medications, injectable preparations. The oil-based injectable estrogen medications called depot medications are prepared to prolong the medication's action. Male hormones can be used for treating certain female breast tumors that grow faster in the presence of estrogen. Androgens suppress the effects of estrogen, thus preventing rapid growth. For women with endometriosis, androgens can cause suppression of the endometrium and thus prevent the excessive uterine bleeding associated with the disease. Progesterone is naturally occurring as progestin is the female hormone secreted from day 14 through day 28 of the menstrual cycle. This hormone has many functions, including changing the secretion of the cervix and reducing uterine contractility. Other actions include stimulating the development of ducts and glands of the breast in preparation for lactation. Progesterone, Provera, Depo-Provera, Depo Sub-Q Provera 104. It's indicated for amenorrhea, contraceptive, and abnormal uterine bleeding, endometriosis, and endometrial cancer. Female hypogonadism is the lack of estrogen produced in the ovaries. In adult women, hypogonadism can cause infertility and early menopause. An infertility treatment evaluation typically begins after 1 year of regular unprotected intercourse in women under age 35 and after 6 months in women over 35. In rare cases, a prescriber will use Clomid and Menopur for male infertility. And that is the Clomid here that stimulates the FSH and LH and is usually given daily for 5 days in the initial cycle therapy. Oral contraceptives provide birth control by preventing ovum fertilization through an oral dosage form. Other forms of contraceptive medications include vaginal rings, patches, and IUDs. There is non-pharmacological methods such as surgery, the rhythm method, mechanical devices. Of all the various birth control methods, oral contraceptives have the highest incident of side effects. Smoking increases the risk of cardiovascular events. So usually after a woman is 30 or 35, I can't remember exactly, if they're smokers, the doctor will not allow them to be in birth control. Combination oral contraceptives may consist of estrogen and progestin to inhibit ovulation. The progestin only contraceptives are called mini pills. Most frequently, they're prescribed because they're highly effective combination contraceptives. These combination medications come in monophasic, biphasic, triphasic, and estrophasic formulas. In monophasic regimens, the daily estrogen and progesterone dose remains constant through the menstrual cycle. In the biphasic regimen, the estrogen does remain constant, but the second half of the cycle's progesterone dose increases. Triphasic divides it into 3 phases. Oral contraceptive effectiveness largely depends on the woman's adherence to the medication. So it should be taken at the same time every day. If a dose is missed, the chance of ovulation is still small. The risk of pregnancy increases with each dose that's missed. In general, if one dose is missed, they should take it as soon as she remembers, and she should take the next pill on the regular schedule. This may mean taking 2 pills in one day or in the same dose. If she misses 2 doses, she should take 2 tablets on each of the next 2 days. The patient should use a backup barrier contraceptive for 7 days if she misses 5 or more pills, or if missing any pills from the first 2 weeks of the cycle. And some combination oral contraceptive risks include thromboembolism, which is a myocardial infarction, and stroke. These risks increase in smokers. Table 24.3 lists select contraceptive products. There's a lot of birth control out there. You can see in the estrogen and progestin category. Then we have a bunch of different categories like vaginal rings, emergency contraceptives, transdermal combinations, IUDs. So some non-pill forms of birth control that are good for women that may forget to take it at the same time every day or forget it in general. We have the transdermal patch that's applied weekly for 3 weeks. The 4th week is patch free. The current recommendation for these patches is to apply the patch to the upper arm, back, abdomen, or buttock. The patient should wear the patch for 1 week, then remove it. They should apply a new patch the same day of the week for the first patch was applied. The 4th week should be patch free. We have IUDs, Mirena, Kylena, Lietta, Skyla. Menopause is an age-related natural loss of hormone production. Although this is not a disease, menopausal symptoms such as hot flashes can lead women to seek hormone replacement therapy. There's a lot of different forms of estradiol, just like birth control. Pelvic inflammatory disease is an inflammation of the female reproductive organs. The severe inflammation of the uterine lining, fallopian tubes, or ovaries can cause chronic pain and permanent infertility. Table 24.4 lists select treatment regimens for pelvic inflammatory disease. So there's oral regimens, parenteral regimens, alternative parental regimens. The 2 testes in men produce and secrete sperm, spermatogenesis. The testes are in the scrotum. Sperm production begins before puberty and declines with age. although most men produce sperm throughout their lifetime. The production of testosterone helps adjacent organs grow. The prostate gland, seminal vessels, vas deferens, and others. Testosterone also carries the responsibility for secondary sex characteristics such as the male voice deepening into puberty and increased muscle development. Figure 24.8 depicts the testes. In the man, the reproductive system is closely tied to the urinary system. The urethra passes through the penis, is surrounded by the prostate gland, and is responsible for voiding urine and serving as an exit route for sperm upon ejaculation. 24.9 figure depicts the male reproductive system. The prostate is about the size and shape of a walnut. It encircles part of the urethra, the tube that carries urine out of the bladder and through the penis. Collectively, androgens are the male sex hormones. Testosterone is the most abundant androgen. At puberty, androgens stimulate the formation of secondary male characteristics, such as increased muscle mass, voice deepening, and facial hair growth. Although females produce testosterone, androgens play a less significant role in female sex characteristics and reproductive processes. Hypogonadism is the condition where men cannot produce enough testosterone. Lack of testosterone can cause fatigue, decreased sex drive, and difficulty concentrating. Table 24.5 lists select androgen supplements. Testosterone, fluoxymesterone, we have gonadotropins. For methyltestosterone, it is a controlled 3 narcotic. It's used for male hypogonadism and delayed puberty in men. In women, it is used as a palliative treatment for metastatic breast cancer. Secondary exposure to children to testosterone products is a concern. Men using this product should cover the application site and not hold small children to avoid testosterone transfer. Benign prostatic hyperplasia, which is commonly called BPH, is an enlargement of the prostate gland. The prostate gland is positioned between the bladder and urethra and encircles the urethra. When the prostate enlarges, it makes urination difficult. This is benign because the prostate growth is non-cancerous and will not metastasize. BPH occurs in about half of men by age 50. It is non-cancerous and non-lethal, but a daily disruption. The Bph treatment goals are to relieve symptoms such as urinary hesitancy, urine stream decrease, post-voiding dribbling, urinary frequency, and nocturia to prevent urinary tract infections. Table 24.6 lists select treatments for the management of benign prostatic hyperplasia. We have 5 alpha reductase inhibitors like Proscar and Avodart, alpha-1 blockers like terazosin and doxazosin. See, all of those in that class have the common ending of zosin, and these have the common ending of teride. Combination medications of alpha-1 blocker and 5 alpha reductase inhibitors like Jalin have both dutasteride and tamsulosin in them. Phosphodiesterase type 5 inhibitors, Cialis. 5 alpha reductase inhibitors block the conversion of testosterone to a more active androgen. that increases the growth of cells, thus reducing prostate tissue growth. These agents can take several months to reach full effect. Finasteride, indicated for BPH. The common adult dose is 5 milligrams once daily. And just note that finasteride is also available as a 1 milligram dose for male pattern baldness. And just a reminder that 5-alpha reductase inhibitors may cause birth defects. Therefore, a woman who is pregnant or trying to become pregnant should avoid contact with crushed or broken tablets because the active drug can penetrate through the skin. Alpha blockers for BPH work selectively to inhibit alpha-1 receptor sites. Some agents like terazosin are less selective for prostate tissue and more appropriate for hypertension treatment. Agents such as terazosin and doxazosin commonly cause orthostatic hypotension. Patients should take their first dose just before bedtime to avoid becoming lightheaded and falling. Other drugs like tamsulosin have more of a target activity for prostate tissues. Erectile dysfunction is the inability of the male to achieve or maintain an erection, commonly referred to as impotence. ED is caused by an insufficient amount of blood flowing to the penis rather than a lack of sexual desire. ED ranges from rarely to a chronic problem. As a man ages, the probability of ED increases. Table 24.7 lists common causes of erectile dysfunction. Cigarette smoking, it can worsen atherosclerosis, which increases the possibility of erectile dysfunction. Depression and anxiety. Depression can cause or worsen ED due to stress, anxiety, low self-esteem, fears, guilty feelings. Low testosterone levels, medications, nerve damage, prostatitis, substance abuse. Prostate cancer is a condition in which the prostate cells grow uncontrolled and form tumors. This blocks the urine flow through the prostate. African American men are more likely to develop prostate cancer, as are men who have had relatives with prostate cancer. Table 24.8 lists select agents for the treatment of erectile dysfunction. When we talked about BPH, we talked about phosphodiesterase 5 inhibitors like Cialis, that's used for daily for BPH. It is also used for erectile dysfunction in the same class as Viagra and Levitra. You can see they all have the same common ending. The medication Caberject is a prostaglandin vasodilator that is given intracarbonas injection before sexual activity. And there's Muse intraurethral suppositories. Table 24.9 lists select hormonal prostate cancer treatments. For the luteinizing hormone releasing hormone, we have leuprolide and goserelin. And then we have anti-androgens like flutamide. Any disease transmitted by sexual intercourse is called an STD. Some practitioners use the expression sexually transmitted infection to indicate that some infections never develop into a disease. Certain STDs, like syphilis and herpes, can remain dormant, Latin, for long periods. This results in more transference between partners until the symptoms become more obvious. Bacterial, viral, fungal, and protozoal organisms can cause STDs. If left untreated, they could cause sterility, blindness, and death. Table 24.10 lists select sexually transmitted diseases and their potential treatments. So it lists their organism, the infection, generic name, trade name, and common dosage range. So for chlamydia, these are all of the medications that are recommended and how long. For gonorrhea, same thing. Genital herpes, syphilis, Trichomonas vaginalis, which is just commonly called trick, bacterial vaginitis, vaginal candidiasis, gonorrhea can have mild or no symptoms. Genital herpes, which can lie dormant for months, years, or decades, causes small red bumps or blisters or a rash on the genitals. Hepatitis, which infects the liver, can cause fatigue, nausea, vomiting, darkening of the urine, or yellowing of the skin. Some vaccines, such as Gardasil, can provide protection against certain human papillomavirus infections, but do not protect against all STDs. Table 24.11 lists select agents for the treatment of HIV and AIDS. Nucleoside reverse transcriptase inhibitors are like Retrovir, Epivir, Fidex. Then nucleotide reverse transcriptase inhibitors like Vired, protease inhibitors, non-nucleoside reverse transcriptase inhibitors, fusion inhibitors, CCR5 blockers, and integrase inhibitors. Table 24.12 lists select agents for the treatment of hepatitis B and C. So here's hepatitis B. You can see that some of the medications are the same or have like the same type of endings like the previous chart for HIV and AIDS. Hepatitis C, antiviral, protease inhibitors, combination products. Recently, drug research has made major breakthroughs for chronic hepatitis C treatment. A disease cure is now possible with certain novel antiviral combinations. Two recent trade name medications for hepatitis C include the Vericapec and Harvoni. Both medications have multiple active ingredients combined in a single pill, increasing compliance. Unfortunately, treatment cost is very expensive. Patients normally pay between $40,000 and $45,000 for one treatment, even after the help of Medicaid. And as always, take a look at these sound-alike, look-alike drugs.